Rheumatoid arthritis, the problem and nutritional solutions. Rheumatoid arthritis, RA, is a chronic, autoimmune disorder characterized by inflammation of the joints, leading to pain, swelling, stiffness, and in severe cases, joint deformity. This debilitating condition affects millions of people worldwide, with a global prevalence of up to 1% of the population. Hello, this is Jenny. RA can lead to disability, cardiovascular diseases, disruption of work, social isolation, and reduced quality of life. Today, let's see how we can address this problem and manage symptoms early to improve overall well-being. Underlying causes. The exact cause of rheumatoid arthritis is not fully understood, but it is believed to be a combination of genetic, environmental, and lifestyle factors. Abnormal immune response. RA arises when the immune system mistakenly attacks the body's tissues, particularly the synovium, the lining of the membrane surrounding the joints, that produces fluid to facilitate smooth joint movements. This leads to inflammation and joint damage, commonly affecting the hands, knees, or ankles. While joint pain and stiffness are common symptoms of osteoarthritis, gout, and rheumatoid arthritis, there are differences among them. Osteoarthritis is caused by wear and tear on the joints, gout is inflammation caused by uric acid, and rheumatoid arthritis is an autoimmune disease resulting in bone erosion and joint deformity. Gender and age. Women are 3 times more likely than men to develop RA, which most commonly begins between the ages of 30 and 60. RA is rare in men under the age of 45. Genetic predisposition. Having a family member with RA increases the odds of developing the condition. Human leukocyte antigen, HLA, genes help the immune system distinguish between proteins produced by the body and proteins from invaders like viruses and bacteria. Certain genes, such as the HLA-DRB1 gene, can increase an individual's risk of developing RA. Environmental triggers. Factors like smoking, exposure to pollutants, certain infections, e.g., Epstein-Barr virus, parvovirus B19, and hormonal changes, e.g., during pregnancy, may play a role in the development of RA. Lifestyle factors. Obesity, chronic stress, and a sedentary lifestyle have been associated with an increased risk of developing RA or exacerbating its symptoms. Diet. While diet alone is not a direct cause of RA, certain dietary factors, such as a high intake of processed foods, refined carbohydrates, sugar, saturated fats, and low intake of antioxidants and essential nutrients, can exacerbate inflammation and worsen symptoms. Symptoms and stages. Rheumatoid arthritis affects everyone differently. In some people, joint symptoms develop over several years, while in others, RA symptoms progress rapidly. Common signs and symptoms of RA include tenderness, pain, inflammation, swelling, stiffness, fatigue and weakness, fever, loss of appetite, joint deformity, and fusion of joint. Early signs. Early signs of rheumatoid arthritis include tenderness or mild pain in small joints like those in the fingers or toes. They might not always be strong enough to affect daily life, and there may be no sign of redness or swelling in the joints, but it is an alarm to be alert and seek prompt treatment. Inflamed tissue. When joint pain, tenderness, swelling, or stiffness lasts for 6 weeks or longer, it may indicate the development of RA. Joint stiffness is usually worse in the mornings and after inactivity for long periods. The tissue around the joints is inflamed and begins to damage the cartilage, which normally acts as a shock absorber in the joints. It tends to affect smaller joints first, particularly the joints that attach the fingers to the hands and the toes to the feet. There is no destructive change in the bones yet, as seen on X-rays. Severe inflammation. As the disease progresses, symptoms often spread to larger joints like the wrists, knees, ankles, elbows, hips, and shoulders. In most cases, there is symmetrical joint involvement, meaning symptoms occur in the same joints on both sides of the body. The inflammation is so severe that it damages the bones by wearing down their ends within the joints. You'll experience more pain, swollen joints, stiffness, and even less range of motion. Living with chronic pain can be exhausting, causing you to feel fatigue and weakness. Erosive RA is an aggressive form that causes rapid joint damage and deformities. If left untreated, the bone itself erodes, which can lead to the fusion of the joint, an effort by the body to protect itself from constant irritation. Extra-articular RA. The inflammation may stop, but the joints continue to worsen, with severe pain, swelling, stiffness, and loss of mobility. About 40% of people with RA also experience signs and symptoms affecting organs other than joints, leading to additional complications. Areas that may be affected include skin, rheumatoid nodules, small lumps under the skin over bony areas. Eyes, dryness, pain, inflammation, redness, sensitivity to light, and difficulty seeing properly. Mouth, dryness, gum inflammation, irritation, or infection. Lungs, inflammation and scarring that can lead to shortness of breath and lung disease. Heart, inflammation can damage the heart muscle and surrounding areas. Blood, a lower than normal number of red blood cells. Blood vessels, inflammation of blood vessels that can lead to damage in the nerves, skin, and other organs. Other parts of the body being affected may include the kidneys, salivary glands, nerve tissue, and bone marrow. Painful joints also make it challenging to exercise, leading to weight gain. Being overweight may increase the likelihood of developing high cholesterol, diabetes, heart disease, and high blood pressure in people with RA. Rheumatoid arthritis flare symptoms. The symptoms of RA have ups and downs. A flare is a time when you experience significant symptoms, flares, after a period with no symptoms, remission, which may last for days or months. Common solutions. The damage rheumatoid arthritis causes to cartilage and joints is permanent and have no known cure. The objectives of RA management are to focus on early prevention, stop inflammation, relieve symptoms, improve joint function, and reduce long-term complications. It typically involves a combination of lifestyle modifications, physical therapy, nutritional therapy, medication, complementary therapies, and surgery. Exercise. Gentle exercises and physical therapy are important for maintaining a good range of motion, muscle strength, joint flexibility, increased endurance, and overall mobility. Having a regular exercise routine and incorporating movement into daily life is beneficial. For example, using the stairs instead of the elevator, taking a walk during lunchtime, swimming, and cycling can help improve overall fitness and cope with RA symptoms. However, it's essential to balance activity with rest, especially when joints feel painful, swollen, or stiff. Taking breaks throughout the day protects joints and preserves energy. Healthy diet. A balanced, nutritious diet is beneficial for reducing inflammation and other symptoms of RA. Incorporating good fats and minimizing bad fats, salt, and processed carbohydrates is recommended. People with RA also have a higher risk of coronary artery disease. A healthy diet helps reduce the risk of high blood cholesterol, promotes overall wellness, and makes it easier to maintain a healthy weight. Weight management. Maintaining a healthy weight is helpful for individuals with RA to reduce joint stress due to excess body weight, decrease inflammation, improve mobility and physical function, and reduce the risk of developing other chronic conditions, comorbidities. Smoking cessation. Smoking is known to have pro-inflammatory effects on the body. By quitting smoking, individuals can reduce inflammation and potential severe symptoms, reduces the risk of respiratory complications as well as other extra-articular manifestations. Relief treatments. Heat treatments, such as heat pads or warm baths, can soothe stiff joints and tired muscles. Cold treatment acutes pain and swollen joints as it can numb painful areas and reduce inflammation. Topical products in the form of creams, gels, or stick-on patches can ease pain in a joint or muscle. Stress management. Stress has been shown to have a detrimental effect on the immune system, which plays a crucial role in the development and progression of autoimmune diseases. Stress management techniques, such as mindfulness meditation, deep breathing exercises, yoga, progressive muscle relaxation, massage, and acupuncture also help individuals better cope with the emotional impact of RA. Medications. Non-steroidal anti-inflammatory drugs, NSAIDs, disease-modifying antirheumatic drugs, DMARDs, and biologic agents are commonly prescribed to reduce inflammation and slow disease progression. Surgery. Some surgeries may be an option to restore function to severely damaged joints, such as knee replacement, hip replacement, and other procedures to correct deformities. Nutritional solutions. While these conventional approaches can be effective in managing RA, addressing underlying nutritional imbalances can support overall health and potentially enhance the effectiveness of other treatments. Certain nutrients may help alleviate RA symptoms by reducing inflammation, supporting joint health, and enhancing the immune system. Omega-3 fatty acids. Omega-3 fatty acids, particularly EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid, have potent anti-inflammatory properties and reduce joint pain and stiffness associated with RA. Good food sources include fatty fish, salmon, mackerel, sardines, flax seeds, chia seeds, and walnuts. Vitamin D. This vitamin plays a crucial role in immune function and bone health. Foods rich in vitamin D include fortified dairy products, egg yolks, and fatty fish. Antioxidants. Vitamin C, vitamin E, and selenium are antioxidants that neutralize harmful free radicals, reduce oxidative stress, and protect joint tissues from damage associated with RA. Consume citrus fruits, berries, leafy greens, bell peppers, tomatoes, nuts, and seeds from daily diet. Curcumin. Curcumin, the active compound found in turmeric, fresh or ground, has potent anti-inflammatory and antioxidant properties. It has been shown to help reduce joint pain, swelling, and stiffness in individuals with RA. Health supplements. While meeting daily nutritional requirements solely through diet can be challenging, consider taking quality supplements for convenience and effectiveness. It is recommended to take a comprehensive supplement such as Lifepak for a well-balanced supply of essential multivitamins, minerals, and trace elements needed for optimal health and well-being. You may also include marine omega for its anti-inflammatory properties and joint lubrication, cartilage and bone formulas for overall joint health, and Reishi Max to improve immune function. Rheumatoid arthritis is a complex autoimmune disorder that can significantly impact an individual's quality of life and requires a multifaceted approach, including nutritional solutions, to manage symptoms, improve quality of life, and promote long-term joint health. Thank you for watching. Please subscribe, like, and share this channel to receive more updates on health and anti-aging. Bye for now, and see you again soon.